Okay, now we're going to go on just like we had just taken that irrigation sleeve off and everything, and we're going to change the wafer. So the supplies that you have gathered up at the beginning with your irrigation supplies and everything, you want washcloths and a towel, you want a wafer. These come in all different sizes, and usually when they first get one, that'll be determined. There's different companies that make them with different types of adhesives and everything. Some people can wear one, they can't wear another. It's just like everything else. So, but that is, when we refer to a wafer, this is what we're referring to, the colostomy wafer, okay? And this has got adhesive on the back, and it's going to go down on the skin. We have a measuring guide, and you should always use these. A lot of people just kind of toss these aside, especially if it's on a new stoma. A new stoma will gradually get smaller over 6 to 8 weeks. Also, you can have some post-op swelling of the tissue and skin around it. So you need to be monitoring and make sure that this wafer is not choking, if you will, the stoma, because you can get a lot more problems out of that. So that's the measuring guide. We'll need scissors. We'll need skin prep. These come in a lot of different methods now. This is just like a prep pad. There's also some sprays and different things, but this helps the wafer adhere to the skin. You've got your paste, which you want to use this. When you cut the stoma hole out, you don't want it, you want it to be about a 1/16 to an 1/8 of an inch larger than the stoma to keep it from, like I said, choking or smothering the stoma. So this actually goes on after you cut it. It will go on and it forms like a seal. It's kind of like caulking, if you will, for that, because you don't want what's coming out of that stoma to get on the skin, okay? This is the actual pouch, also called, it's also colostomy bag, and I might mess up and call it a bag at some point in time. But this is all it is, and it fits on just like a seal. And you don't want to smooth it all the way out. It needs to have a little bit of air in it. But people can actually burp them. And why do you think you would burp them? Because even though you've got stool and everything, you have gas that comes out through them. And there's a couple of different ways that you can burp them, if you will. You fold it up, and you make the seal. This is one of those times that you want to make sure that you've got a good seal on it, because this is hanging on the patient usually like this, and they'll tuck it in their belt loop or their underwear or something, and so you want to make sure that that seal is good down there. An ink pen, because once you measure, you get to draw on the wafer to make sure the size, and definitely a biohazard bag. Okay, so there's our supplies for it. So my wonderful person who's going to film is going to step around to the other side so she can watch me do it. I've still got my linen saver pad underneath the side over here, because like I said, we're making believe we've just taken off that irrigation sleeve. So I've got a red bag I'm going to have handy. Okay, and what I'm going to do is I'm going to, as gently as I can, I'm going to take the edge of this and I'm going to pull it up. And these have some great adhesive on them, so I'm going to pull it up, and when I get up, it will never come off that easy, okay? You'll still have paste, you'll still have adhesive, you'll still have all those other things around it. So what you're going to do, you're inspecting that stoma. Again, you want it to be beefy red. You don't want it to look like it's pale. You want it to be real moist and everything. So this wafer, biohazard because it'll have stool on it. So we're going to take our washcloth, and only with warm water, no soap. Soap can irritate it, so just warm tap water, and you're going to go around and you're going to clean it. You're not going to rub, it's just a real gentle cleaning, okay? There's also some specially made adhesive removers if you've got adhesive or paste on there that you need to get off, and then just go back and clean it with the warm water. you want to make sure that when you dry it, you're patting it dry. You don't rub or anything like that. This is very tender skin. And remember, it's just like after you've taken a Band-Aid off something. If you've ever taken a Band-Aid off your abdomen, you know it's not comfortable. So this is some heavy-duty adhesive to make sure that that pouch stays on. Okay? So we've got it dry. We're going to apply our skin prep. If we're using this, we'll do it. And that'll have kind of a, you want it to get where it's kind of a sticky sensation to it, because what that's going to do is help the wafer adhere. So you're going to take your measuring guide and you're going to look. Okay, that one actually looks pretty good. So it's the 1.5 inch one, so that's the one I'm going to use, and they'll each have the measures on it. So all I'm going to do is I'll take the wafer and I'll put it over this, and I'll kind of center over it. And you wouldn't set this on the patient, you would do it on other, but for filming's sake, you would center it and you would draw a line. Okay? So you've got the line drawn. And the little scissors that come in the suture kits are awesome for doing this, because you don't want any very big scissors. And you're just going to cut your line all the way around it. Whoops, sorry. Now your first one might be kind of a ragged looking line, because you'll see why in a minute, because you're going to go back and you're going to make it nice and neat. Just like wrapping up a Christmas present, you've got to make it look better than that first rough cut, but that lets you get in there. Okay? So just toss that, and you're going to come back and make sure that you have the line cut out. I think these scissors have been used a little bit. And there it is. Okay. Now, you can see how kind of jagged and stuff that is. But with this, you can take your finger and kind of smooth it out. Okay? And you can get it a lot smoother than that on one that hasn't been set out or anything like that. So, once we get all of that done, we've got it nice and done, we're going to take the backing off. This backing's been taken off. We're trying to reuse some supplies here. And so that's what it's going to look like. This is where the paste comes in. Your paste, you'll put not a huge amount, but just like spreading some on a toothbrush around the edge like this. So what happens is, your skin prep should be good and tacky now. This is going to stick. You center it, and as you center it, what's going to happen is that paste is going to form a seal up around the stomach, but it's going to be a movable seal. So it's not going to be like this rigid, even though it's soft plastic, it's more rigid. It's not going to be like that up against the skin, because this paste is going to kind of seep through, just like, you know, when you put peanut butter on a sandwich or something. Okay? And you want to make sure that it's sealed down good. You want to make sure that that paste is up through there, because this is fecal contents. You don't want it on that real tender peristomal skin. So make sure it's on there good. Now, all we've got left to do is put the pouch on. I showed you how to put the seal on, so I got the seal on good. When you put the pouch, if it's one that's got an open end, you put it on open, and it's just like putting a seal on a bowl someplace. You go around very slowly